Welcome back, everyone. Well, thalassemia, blood conditions, things that we all need to know about, particularly if you happen to have somebody in your family or a dear one or a loved one who might be suffering from some such disease. We have Dr. Waleed Azhar from the Fatimid Foundation, Chief Operating Officer. Thank you very much for joining us. I know that thalassemia is a blood condition. I don't know exactly what it is. So for my benefit and the audience, maybe you could...
It is an inherited genetic blood disorder in which the hemoglobin is not formed properly, and because of that, then there is red blood cells hemolysis and anemia results. And this also reduces because the red blood cells carry oxygen from lungs to the tissues. So this reduces the capacity of oxygen carrying capacity of the patient. And unless you transfuse red blood cells to the patient, there's chances of survival for more than 1-2 years is very bleak.
I understand also that there are two types of yes, thalassemia, and my question obviously is what are those two types? That is there, but when you say it's genetic, I think I know of incidences when parents have not had it, and then the children are born and they are diagnosed with thalassemia. How does that happen then? I
don't think that there's any case of this kind of thing happening, although theoretically it is possible that there is a genetic mutation, but the cases so far reported in literature and also the experience we have, there is not a single incidence where a child is born with thalassemia and his or her parents are not thalassemia minor, the carriers of the defective gene.
Does it have to be a parent or can it be a grandparent?
No, there has to be a parent. Both parents must be thalassemia minor. Then the child will, there are 25% that any child born to them will be the thalassemia major. Yes.
So the risk level is quite high, isn't it?
Yes, very high. Very high.
Okay, moving on. How would you diagnose this condition, disorder?
Normally the child at the time of birth is normal and it's taking the feeds normally and it is sleeping normally, but after 4 or 5 months when the adult hemoglobin is not formed and the fetal hemoglobin is disappearing from this body, then the child becomes restless, its colors turns pale and it is crying a lot, and then it's maybe even vomit is food. At that time, the parents gets worried about their child and they take it to a general practitioner. Because he will examine, then he will notice the paleness of the skin. So he will most probably send them for the blood test. In the blood test, that a normal simple blood test is
CBC,
the complete blood count, or CP, the complete picture. In that there is a reduced hemoglobin around 3 to 7 grams per DL. At that time, if the doctor is aware of this condition, he will go for the confirmatory test, that is hemoglobin electrophoresis, HB electrophoresis. That test confirms that whether the child is suffering from beta thalassemia major or it is suffering from anemia from any other
cause. So basically you need to get a basic blood test done.
Yes.
And the basic blood test will determine whether further testing should be done to confirm thalassemia. Yes. That's how it works.
Yes.
And how much is the incidence of thalassemia in our country?
There are estimated 100,000 patients suffering from beta thalassemia major in the country, and the carrier rate of general population is 5%.
Okay.
Those people who are carrying the genetic defect are 5%.
Do we know why that exists? Do we know why this is?
No, there are theories. Some theories
abound in our country. They abound anyway.
Right. The thalassemia is derived from the Greek word thalassa, which means sea, and anemia is the lack of blood.
Right.
And this disease was noticed around the Mediterranean area. And most probably when the Greek came to India, they brought it.
Blame it on a foreigner.
Right.
Blame it on a foreigner.
Right. Or you can, there's another theory that wherever there is a malaria endemic, which there is a prevalence of malaria, In that country, there is a natural mutation of the gene to save up one person from the malaria. Interestingly, the thalassemia minor show resistance against falciparum malaria. So this is a type of malaria. They are resistant to that malaria. The thalassemia carriers.
Got it.
That is thalassemia minor.
Right.
Because their red blood cells are different. They are more resistant to the malaria
strain of malaria.
Yes.
Strain of malaria.
So in a way, this was a mutation to protect person against malaria. But when the two thalassemia minors, they get together, marry, and then the result is thalassemia major. 25% of their newborn have chances of getting beta thalassemia major.
It's a tragedy on many fronts. There's the medical tragedy, and then there's the financial tragedy.
Financial,
because
emotional,
there is emotional
as well.
tragedy.
Yeah.
From what I understand, chances are that most thalassemia patients, particularly thalassemia major patients, don't survive. Is that correct? Do I understand this correctly?
First is if they don't get the blood transfusion, they will die at the age of 1 to 3 years. If they get regular blood transfusion and they don't get the medicines to remove the iron overload, which is caused by the blood transfusion, then they will die at the age of 10. If they get the regular iron chelation, we call that iron chelation, the removing of the iron from the body. If they get regular blood transfusion plus regular iron chelation, then the survival rate as we have the studies done in Europe, their survival rate is 80%. They will reach 48 years of age.
Okay, much later in life.
Yes, they will survive up to 48. 80% of them will survive.
They will survive.
Right.
I'm thinking also from the point of view of the emotional fallout of this. There must be damage to the brain, I'm guessing, of a child who might be a thalassemic baby. Is there damage? You're saying that there's a reduced rate of oxygen available in the blood. So does that not affect the way that the baby develops?
If a baby is diagnosed at the early age, then he or she will not have this complication.
Right.
But if it is if something on the later stages, there is a chance that they will develop mental handicap as well, but very less chance.
I have here a list of symptoms which I just like to reconfirm with you that are particular to thalassemia. As you said earlier, pale and listless appearance.
Yes.
Maybe dull eyes. Is that be a correct way to look at it? Poor appetite.
Poor appetite, lethargy.
Yeah. Urine is dark. Is that right? Urine is dark. Delayed and slow growth, delayed development.
Yes, because of urine will become dark because of the breakdown of the hemoglobin, and then the bilirubin will flush out through the kidneys, so it will be dark. But the major symptoms will be the paleness, the lethargic child, and it is not sleeping properly, and the poor appetite. These will be the major symptoms of...
But these are quite common symptoms for other ailments as well. Is it not easy for parents to become confused or maybe ignore them?
Yes.
Or is the indication that a parent is thalassemic, therefore you must have your child tested?
Whenever these symptoms appear, then the child must be taken to a general practitioner or a child specialist, who will then further investigate and then make the proper diagnosis.
And most parents who are thalassemic are aware that they are thalassemic when they have children?
No, majority of them are unaware that they are carrying that defective gene.
Ooh, scary thought, but we must hold our thoughts for the minute because we have to go to break now. But after the break, we stay with Dr. Waleed and find out more about thalassemia.